Good morning and welcome to the People and Health Overview Committee on the Tuesday, I nearly said Monday, Tuesday the 3rd of May 2022. For the benefit of the live stream, I'm just going to go round and ask councillors to introduce themselves, just who you are and what ward you're from, and then we'll go with the meeting. So. In no particular order, I'm just going from one side of the room to the other. Councillor Holloway.
Good morning, Chair. Councillor Holloway, ward member for Wareham.
Councillor Azard.
Good morning, Councillor Jean Dunseith, Chickerell ward.
Anthony Alford, and I represent Egerton ward.
Stella Jones, Dorchester East.
Councillor Rebecca Knox, Beminster ward.
And I should have said again, for the benefit of the live stream, I'm Councillor Mike Parks, I'm chairman of the committee, and I'm Ferndown North ward. Just for the benefit of those in the room, the way I'm going to run this today is committee members will speak first on any items, and then if other members do wish to speak on any item, then we'll take them afterwards, providing it doesn't repeat something that's been said by committee members previously. Officers and cabinet members, if you can introduce yourselves when you speak, thank you. We move on to item 1, which is apologies.
We have apologies from councillors Pauline Batstone and Pete Barrow.
Thank you. Declarations of interest. Does any member have any declarations of interest or anything on the agenda this morning? Councillor Azard.
On item 7, talk about family hubs. If they talk about the Wareham Youth Centre, I'm a trustee of the Purbeck Youth and Community Foundation. Obviously, people need to know that. Thank you.
Thank you, Councillor Azard. Anyone else got any declarations of interest? If anything does crop up during the meeting, then by all means, please declare that at the time. Thank you. Move on to item 3, which is the minutes of the meeting of the 24th of March 2022. Could members confirm they were happy with those? Yeah, could I have a proposer and a seconder, please? Thank you. Councillor Alford proposed, seconded by Councillor Dunseith. All those in favour? Thank you, that's unanimous. And I will sign those at an appropriate point after the meeting. Public participation, there is none, and there are no questions from members of the public. Go to item 6, which is the Youth Justice Plan for the year 22-23, and I believe that's going to be presented by David Webb. Okay, over to you. Thank you.
Good morning. I'm David Webb. I'm the manager of the Combined Youth Justice Service. So our service works across BCP Council and Dorset Council. It's a statutory requirement that we publish an annual youth justice plan. And that plan has to set out the resourcing, partnership arrangements, performance and priorities of the service. The Youth Justice Board provide guidance for what should be in the plan, and this year they've issued more detailed guidance, which includes more specific requirements about what should be included and also a template. So the document that has been circulated follows a Youth Justice Board template and therefore is quite detailed in places and answers questions related to Youth Justice Board scrutiny, as well as enabling us to provide our local strategic plan for Dorset Council and for BCP Council. In the plan, you will see that performance of the service has been identified collectively, but also separated out into the 2 local authorities. So it should be possible to see the Dorset Council performance. And I particularly draw attention to successes we've been having in ongoing work to reduce the number of children entering the justice system. That's a national priority for the Youth Justice Board, but also locally it's very important to us and fits with Dorset Council's commitment to early intervention, prevention and diversion work. So you may see that the numbers of children entering the justice system in Dorset, that means children who receive a caution or a court order for a criminal offence, has dropped quite significantly. In the last 4 years, that's dropped from 108 in 2018-19, and this year, the final figure, which is I can update from what's in the plan, was 40 children. So down from 106 to 40 in the last 3 years. We also have a target, which again is a local priority, but also a national one, to avoid using custody if at all possible. And I'm very pleased to say that no Dorset, for the second year running, no Dorset child received a custodial sentence in this past year. The plan sets out our strategic partnership arrangements. We are a multi-agency partnership, which includes not just the local authorities, but also Dorset Police, the CCG and Dorset Healthcare and the Probation Service. And our aim is to make this a strategic document which links to other strategic priorities across those organisations and other partnerships. You'll see towards the end of the document, we set out our priorities for the coming year. And I've kind of split those into some which could be described as system improvements. So that's more work to continue to divert children from the justice system, a focus on reducing over-representation of certain groups in the youth justice system, and work to try to improve the efficiency and timeliness of our youth justice system locally, which sits in a context which you may well be aware of pressure on the criminal justice system generally, on courts in particular, which existed before the pandemic but has been aggravated by the pressures of the pandemic. And then there are also some practice improvements which are more about priorities for us within our service as we continue to try to improve the quality of practice so that we can work more effectively, so that the children we do work with who do enter the justice system are less likely to commit further offences, and we can help them build more positive futures. I think that's all I would like to say by way of introduction.
Lovely, thank you very much. Do any members have any comments, questions, or anything they'd like to say? Councillor Alford.
Yes, thank you. First thing I noticed was that this is an annual plan, and it led to me thinking, I wonder what the changes from last year are. And from the text, I didn't have a sense that there was any particular significant change, but in your introduction, there is a sense that the format and presentation has changed quite a bit. So I wonder if you could just elaborate a bit more about what has changed since last year's plan.
Thank you. There's a change to the format of the plan in that we have to provide information required by the Youth Justice Board about more detail about aspects of our services. For example, there's a section in there on our compliance with national standards, which has not been in previous plans. We're required to give more detail on specific aspects of our work, which were alluded to in previous plans, but not put in so much detail. So I think the content and format of the plan is slightly different. But in terms of the actual context of the work, I don't think there has been a significant change from last year. We were making progress in reducing children entering the justice system, and we've continued to do that. We've emerged from the pandemic insofar as COVID is obviously not completely over, but things are changing. And we haven't seen a significant change in the pattern of child offending. I'm saying that hesitantly because I'm conscious that we are all aware that children have had a difficult experience in the pandemic. For example, in engagement with education, in mental health and well-being. And those are two elements that are strongly linked to youth offending. So the children we work with often are not engaged in mainstream education and may well have mental health and other health and substance misuse difficulties. And we're also concerned about some of the impacts of the pandemic on what happened when children were not in school and were spending more time in families where there may be family conflict. So I say that we have not seen a significant change on the previous year, but slightly with my fingers crossed about what might be coming as we start to get the outcome of the pandemic and how it's affected child development.
Thank you. Did you want to come back at all, Councillor Alford, or not?
No, I'm happy with the answer, thank you.
Thank you. Councillor Ezard.
Thank you, Chairman. Yes, I actually on 9.4, you mentioned that the Dorset Combined Youth Justice Service has a low rate of custodial sentences. This is particularly the case for Dorset Council area. And then you say the next sentence, no Dorset children were sentenced to custody in the year April 21 to March 22. Does that just in the Dorset Council area or including BCP? And I've got another question. Shall I ask that? Yeah, okay.
Thank you. Yes, I was trying to be tactful, but there have been some BCP children who have been sentenced to custody, but no Dorset children. But the numbers are low in BCP as well.
Thank you for that. Yeah, the other thing is, well, we all know that the changes in the national situation regards, you know, letting everyone out in March will obviously have an effect. And I had a recent report from the local police in Purbeck that they've had lots of problems with antisocial behaviour since March, in April. And be aware that, they feel as if they've been let out, as it were. And I think we've got to be very, very careful and very vigilant about what's going on there. I just wanted to make that comment. Thank you.
Thank you, Councillor Ezard. I think Councillor Parry wishes to speak.
Thank you, Councillor Ezard, for your comments and observations there. I'd be very happy to discuss them with the Purbeck Police and, of course, the Police and Crime Commissioner following this meeting.
Thank you. Councillor Jones next.
Yeah, there are several points. I think, first of all, it's still very worrying that it's the frequency of people with SEND and youngsters who have been excluded from school. I know we're trying to stop school exclusions, but even a suspension for a temporary time can make these youngsters start wandering around the streets, doing things they shouldn't be doing. And also, secondly, it says somewhere that the health needs are not identified or addressed early enough, and a lot of these youngsters have speech and language and communication problems. I wondered what you were actually doing to solve this problem, because once they can start communicating with people properly, I think some of the problems will stop. And are the youth justice system being involved in the hubs, which is obviously the next item? But I think it's important because we've got to prevent this happening, and preventing happening, it's starting when children are, well, as soon as they're born, basically, with the family's help.
Thank you. If I could answer the first part, and I'll come to David and Claire on the second. In respect of it is widely reported at a national level that, of course, if you look inside the jails of Britain, I hate to say it, you will often see that the inmates there are have been identified as having speech and language issues and additional needs that need to be met. What we're aiming to do is, of course, to try and prevent that. One of the big focuses for Dorset Council throughout the pandemic and beyond is, of course, the inclusion of children and young people in our schools, not to the exclusion of them, and a considerable body of work has gone in to ensure that our numbers are dramatically reduced in comparison to previous years. But it's very, very important that that culture of inclusion in our schools maintains and grows.
In relation to the point on speech and language needs, in 2018 we obtained funding from NHS England to enable us to recruit speech and language therapists, and we've managed, the CCG have supported us to maintain that funding. So we have 1.4 full-time equivalent speech and language therapists in our service, and they assess all the children that receive a court order or a second youth caution, and some others as well. And you're right, they identify that about 80% of the children in the youth justice system have speech, language and communication needs, and in a number of cases, about 30% or slightly more, that's significant needs such as developmental language disorder, which often has not previously been recognised at school. So that does enable us to work more responsively to that child because we can think about their individual communication needs. Families say they find it really helpful to understand why their child has had difficulty communicating and some of the behavioural consequences that follow from that. And families also welcome the chance to better communicate with their child. So that speech and language work is really important. We are also using those practitioners to provide some training for other services. So we're just talking with Dorset Police about running some training sessions for them so that when they interview children in relation to a possible criminal offence, they're aware of the child's communication needs. And we've also done work with the magistrates in terms of what happens in the courtroom. But there's more to do, but we are very alive to those issues.
Thanks. Hi, everybody. I'm Claire Shields. I'm the Corporate Director for Commissioning and Partnerships in Children's Services, and just want to provide a little bit of an update on what we're doing in terms of prevention. So really helpful that we've got speech and language therapists within the youth offending service when people come to their attention. But more important, I think that we identify those potential issues much earlier. So we're doing quite a bit of work with our colleagues in the NHS around commissioning a new pathway for speech and language services. Which means that we will be better able to identify. So we've put some additional investment in, both from the NHS and from the local authority this year, to be able to increase the training offer that we have, both within our early year settings and in our schools, but also in a new way of supporting families to understand communication needs as well. And we're doing quite a bit of campaign work, getting the word out about what it looks like to have good communication and what that means, working with health visitors in particular. Really good work with our health visiting service in identifying speech and language difficulties early, using a thing called the Ages and Stages questionnaire. So all children at 2.5 get a check. Really important point for us to be able to check and think, what are we doing and how we can make that work. So quite a lot of work thinking through that whole pathway and how we work together on that.
Thank you for those responses. Councillor Jones, did you want to come back at all? Okay, Councillor Holloway.
Thank you, Chairman. Just regarding on the end of the report regarding of staff and volunteers, and just looking at the numbers there, do we actually have sufficient numbers to meet demand for what is needed? And also, are we sort of promoting for recruiting new members of staff and volunteers? I just want to be clarified, please.
We do have the staffing level we need. We do have good staff retention, and that is a good thing because it's really important that our workers build relationships with the young people they work with. That's the critical single factor. Having said that, it does mean, obviously, if you have a stable workforce, you don't get that much opportunity to diversify and freshen up the workforce. We have had some people, though, in the last few months, I think possibly as a kind of post-pandemic thing, decide to make new plans, either reduce their working hours or move. So we are in the process of some recruitment, and we do proactively try to make it available to other kind of members of the community so we could diversify our workforce. We've got a very strong volunteer group, but we're always looking to add new volunteers. There are some specific roles that volunteers undertake in our service, and that commitment is appreciated by young people, that people are giving up their time and have a genuine interest in their welfare. And again, we're very pleased with our volunteer group and very supportive of them, but recognise we could perhaps diversify it in terms of things like age and ethnicity.
Thank you for that. Do you want to come back?
Only just to reiterate, obviously, thank you for the officer's question on that, and I'm glad that I was just concerned that obviously because we've just gone through 2 years of a pandemic, that staff are not burned out at all. Making sure that that we. Obviously, the volunteer group is also helping there with the staff as well. So, thank you.
Thank you,
Councillor Knox.
Thank you, Chairman. Just a couple of things. One is just following up on that issue of volunteers. I know we don't want to go into detail of geographical location of where we have potentially serious problems or numbers of young people who need assistance, but would it be possible outside of the meeting that where you feel maybe that ward councillors might be able to assist in identifying assistance? I know we could all tell you in our own areas what we feel back from antisocial behaviour. I know it's a high priority for the Police and Crime Commissioner, because we do have a severe amount of antisocial behaviour. But it'd be really, really good to forge those links, because I'm unaware of them if they are there. But if they're not there, then that would be helpful, but only where appropriate. I think it's really important that we do not identify, because it could be one person in a ward, and that's just not something that we should be considering. But if there was the ability to do that. And my next question, and it might be just a confirmation, it sort of links in. You have a list at the end of the report of who is on the board. May I just get some assurance that there are still the really good link that I know when I chaired the Community Safety Partnership, that is still in place, because the Community Safety Partnership and therefore the mini partnerships across the Dorset area had really good links in and felt that they had a job to do and were positive in that assistance. So that's just sort of two areas. Thank you.
Thank you. If I may respond to Councillor Knox on the first point, I'll ask David to respond on the second. You're absolutely right. It is imperative that as ward councillors we have a duty to our residents and our community in order to assist wherever possible. There may, of course, be troubled individuals or troubled families, and we have that on the ground knowledge, which can be of great assistance to officers of both Dorset Council and our partnership organisations. But you are absolutely correct when you say it is where we have to be appropriate about it, and sensitivities do need to be respected around that. And if any councillor is in any doubt, please come and speak to me about it, and I'll be happy to assist. I'll hand over to David on the second point.
Thank you. In respect of the links with the Community Safety Partnership, thank you for your question. It's a valuable reminder to me. We do have links, and I attend the Community Safety Partnership, and so do some other members of our Youth Justice Service Partnership Board. In the past, we did used to have a representative from the Council's Community Safety team on our board, and we have a board development session planned for this summer. I think where we, amongst other things, will be reflecting on our membership, and that's a valuable point that I can take into that session as to whether we want to re-establish that person attending the board as well from Dorset Council and the equivalent from BCP Council. Thank you.
Thank you. Do we have any other members wishing to speak on this? If not, then can we have a proposer to endorse the Youth Justice Plan so that Cabinet can recommend its approval to full council, please? Thank you. Councillor Jones proposed, seconded by Councillor Holloway. All those in favour? That's unanimous. Thank you, members. We'll move on to item 7, which is the family hubs, and I believe this is going to be presented by Claire Shields.
Morning. Thank you. Following the last meeting, we had a conversation about the Children's Commissioning Strategy, and in the Children's Commissioning Strategy, we talked a little bit about the development of family hubs as one of our key priorities. So we agreed to bring a paper back to just provide a little bit more detail on the work that we're doing around the development of family hubs. And this follows a very early scoping paper last September where we talked about what a family hub might look like. And since then, there has been the release of further government guidance on what the expectations are for local areas to implement family hubs. And there has been some opportunity to bid for funding, both nationally, but as well through the Internal Council Transformation Programme. And Children's Services has successfully secured some funding from the Transformation Programme, and we're still waiting to hear from the government whether we've been successful in the national programme. Further funding has been announced by the government for 75 local areas that are priority areas for family hubs, but unfortunately we weren't included in that 75. But we will keep looking out for other opportunities to bid because we know this is a really important area of work. In terms of family hubs and what they are, family hubs are both buildings, but more than that, they're about how services in local areas join together, think about how we can improve information sharing, have some shared goals, but also link services better in communities. And I know that's been one of our challenges for many years, is thinking through how do we make the connections and how do we do that together. So that's the piece of work that we're working on at the moment, alongside some digital service offers as well. So where we can offer services online, where we can improve our information offer, we will do that. And when we can start to share some of our systems with our partners as well, that's what will make a difference. A family hub is accessible, it's branded, it is all about connecting families with professionals and the voluntary and community sector, and finding spaces to co-locate where that makes sense. But given we are such a rural community, we won't have a family hub in every town. And there are well-established models in other rural areas where one central building acts as a hub for an area and then connects out to other services, and we might outreach services into community spaces as well. So that's what we're working on at the moment. We have a series of engagement events happening with our families. We've started first over in East Dorset, good session over in the Trickett's Cross area, thinking through what might a family hub look like in that area, and we'll work through the county as we move through that. So the timeline for our delivery is trying to get the first one established in East Dorset from September, and then over the next 3 years move that through the whole county. The way we're doing it is we're trying to work with existing buildings where they exist, so that might be one of our children's centres and changing that into a family hub. It might be a library, it might be a community space that already exists where families are already using, and thinking through how we can co-locate different services in that space, but services that make sense to the community and build on what's already there. So that might be a food bank, it might be a citizen's advice, it might be debt advice. So in each local area, they'll look a little bit different. But a really important policy area for us. Build on our locality model that's really successful already in across all the different areas. And the governance for this will be through the local alliance groups. And we've got some planned engagement with ward members to be able to be involved over the coming years so that you can think through what makes sense in your community, who's already there and who is it that we need to connect. So I think that's all I want to say. I'm happy to take some questions on what it's looking like and where we're at.
Thank you for that, Claire. I've got one question before I ask other members. It was just really, and I'd appreciate what you've just said around we can't do it, particularly in sort of rural towns of everywhere. Can you give me a rough idea how many hubs we're talking about across the county?
We haven't settled on a firm number, but we think it'll be about 8 to 10. We'll just look that through. That might be a number of outreach centres that come along on top of that, but 8 to 10 sort of family hub branded buildings reaching out into other places. But we haven't settled on locations, nor would you know exactly which type of buildings they will be at the moment. That's part of the engagement work.
Thank you. And if I could just have a supplementary to that, is how we plan to get those people to the hubs if they're further out from them.
Yeah, absolutely. So I think the hub building will be a really important place for people to travel to, but also we will reach the staff out into other community spaces. So it's unlikely we would expect everybody to travel to those hubs, more about our staff being able to move. So some of the things that have worked elsewhere is like a pop-up family hub outside a school or in a community building one day of the week. So I think that will be twofold. Some of it will be travel to us and some of it will be about the staff going out and delivering in different spaces.
Thank you. That's reassuring. Thank you. Councillor Holloway.
Thank you, Chairman. Just regarding, quickly going back to where you said about the 75 local areas who were eligible for that extra share of funding, have they given a reason as to why Dorset was not eligible for that?
No, we haven't been given a reason for that. It's helpful. We're having some conversations with the National Hub policy team. So all areas are entitled to support through the Anna Freud Centre, which is a linked programme. So there is different funding coming through, and all areas were able to apply for the first round of bidding. So I think this is just around some prioritisation, but we'll keep talking and we'll keep seeing what can happen for Dorset.
Thank you. Do you want to come back at all, Councillor Holloway?
Just to briefly add, Chair, yeah, obviously it's just quite disappointing that Dorset was not eligible for this, but all I can maybe just ask is that we keep pursuing the DFE on this, because I think this would be very, very useful added resources for the county, and I think that is something that we really do need to work hard on for the future. Thank you.
Chair, very happy to give a reassurance to Councillor Holloway and the rest of the committee that, of course, sometimes we do see some pushback from government on our bids. We saw that with the high needs block deficit, for example, but perseverance is the key to this. And if we have to provide new or additional information, we will always do that, because we would certainly welcome additional funding from central government on many of the projects we have and ambitions we have for children and young people in Dorset.
Thank you, Councillor Parry. Next, I've got Councillor Jones.
Well, first of all, I think the hubs are a very good idea to get all the problems for the whole family sorted if we can. But they need to be 24/7, because problems often happen during the evenings or weekends in holiday times. Can I be assured that there will be access to hubs some way for always? Yeah. Shall I do it questions one at a time then?
Thanks, Councillor Joan. Yeah, and we are thinking through about extended service offer and what that looks like. Some of that will be online and digital and being at the end of the phone. We know that works really well for us. And some of it, we're having some conversations with our families about what works for them and when they want those services. So I think that's really important for us, that we extend the day out a little bit, but also that there's someone available to be able to answer some of those questions. And we know what families have told us is that having some trusted source of information and trusted people to talk to in those evenings, in those spaces when they're in challenge is really, really helpful. I think worth noting that this is building on what already we have in place around providing for out of hours and looking after our families when things go wrong as well. So not looking to replace some of that, but build on what we already have and make sure the system works well together.
Secondly, I'm also concerned about the funding. It obviously is going to cost a lot of money to set up these hubs. And if we don't get money from the government, we're going to have a problem. We're also relying a lot on community charities to help us. Now, charities also need money, because it's no use saying, we'll ask Home Start to do something when Home Start haven't got the money to provide the facilities. So are we as a council, because we're going to use voluntary and charity, are we going to then say we'll help with funding for these charities as well as sorting out the main funding?
Chair, if I could take the first part of that question. I was delighted that I received support from the Transformation Board to the tune of £342,000 to get the family hubs work underway. Of course, if additional funding requirements are identified, we will be going back to them and discussing that with them. But it's a significant amount of money and investment that was agreed. In respect to the second point of other charitable bodies, I think I'll leave that to Claire Shields to answer for you.
Thanks, Councillor Jones. And yes, this is part of our overall children's commissioning strategy and about how we link together. So some of it is about making the best use of things that we already commission and things that are already funded, and making sure there's a connection between those. But also, if we identify gaps in provision, thinking through how we commission those together, being really, really important. So we already have a commissioning budget that sits alongside this, which is separate to and in addition to the Family Hubs piece of work, and we'll continue with some of that. And then we'll think through together what that looks like and either seek additional sources of support or finance, or to seek to influence the spend of some of our partners into this space as well. So working with our colleagues in the NHS and our colleagues in the police to think through how best we spend our collective money, really.
The third point is the government did say that all local areas should have hubs in the next 2 years, and that was last year. So we're now halfway through those 2 years. And yet you say that the rest, the East will get some in 2022, but the rest only by 2025. And I'm very concerned that we're leaving the rural areas to last. In the rural areas, there are many hidden problems, and unless we get those sorted, we shouldn't have to leave those areas until 2025. I think the government expects us to do it by next year. That's a long time after that.
Thank you. I think the position the government adopted was to suggest that the rollout programme starts within 2 years rather than was completed within a 2-year period. And that's certainly what we're aiming to do in respect of us reaching out into those most rural parts of Dorset. That's a piece of work that we do all the time and have been doing, and we will continue to do.
I know that the local courts and judiciary are involved in this project. Are we, as I asked at the last session, the last part of the thing, are the youth justice system going to be involved as well?
Yes, absolutely. They will. And Judge Simmons and I are meeting in the next couple of weeks to have a further conversation about implementation of the Family Hub, which is about reducing parental conflict and a different way of supporting families that are in conflict rather than using the courts. We have already started that piece of work and it's moving forward, and absolutely we'll be linking with Youth Offending Service, thinking through what that looks like for our young people as well.
One of the problems is trying to sort the access for children to meet parents that are separated, and rather than going through the courts.
Yes, absolutely. We've started working in a different way, so we're evaluating that as we speak. So we've already started working with CAFCAS and others to think through a different conversation space. So that's in train, happening virtually, and we'll roll out across the rest of the family hubs and thinking through different types of parenting support for families that are in conflict and the impact it's having. So yes, absolutely.
Thank you. Councillor Ezard.
Thank you, Chair. I've got a couple of things actually have been covered by Stella, but I really welcome this initiative and really joining up a lot of the obviously help for families in need. The things that I wanted to tease out really is that any of our neighbouring local authorities in that 75, do you know of or not, that were chosen, and sort of the reasons why, you know, the differences, were they more deprived, were they, you know, in the future, if we were doing bids, how would we sort of put ourselves forward? But the other thing is, you mentioned about this would be, you know, very much rolled out through the local alliance groups. Can you just explain what those are? Because I think a lot of the councillors don't realise what they are, or how many different organisations are involved in those. I'm certainly involved in our local Purbeck one, and it is very, very useful to find out what's going on. Thank you. Thank you, Chair.
Thank you. If I could take the first part of that, I'm not aware of any neighbouring authorities that have been successful in that. They've certainly not shared that information directly with me. However, I'll be happy to take that to the next South West area meeting of my counterparts and find out the lie of the land. In respect of the criteria the government would use, yes, they use a very wide criteria. Sorry, they use a very specific criteria across a very wide geographical area, and it's just possible that we fell outside of that criteria, which is, I suspect, the case. It's always useful to remember how privileged we are to live in such a wonderful county as Dorset. Sadly, not everybody has the same pleasures that we do.
Yeah, and thank you for the opportunity to talk about local alliance groups. So the local alliance groups are subgroups of the Strategic Alliance for Children and Young People. And the Strategic Alliance for Children and Young People is the multi-agency strategic group that delivers the Children and Young People and Families Plan, which you will all have seen. Within each of our localities, we have a local alliance group, which is chaired mostly independently, but it brings together local people and professionals in the area to think through what are the priorities for this locality. So each of our localities has a local alliance group, and in some places they have two. So for example, there is a Weymouth locality group and there is a Portland locality group, because it was felt it was necessary to be able to come together to do that. Elected members are more than welcome to join their local alliance group. It's really helpful, actually, when you're there and understanding what's happening and able to influence the space in there. But other people that are there are schools, health visitors, and people that work in children's services and people that work in the voluntary and community sector. So I'm really happy to send out the contact details for each of those locality groups to members of the committee if they're interested, to be able to do a little bit more. But really helpful spaces to plan services for the local area and to help join up what's happening in local areas as well for children, young people and families.
Thank you. Councillor Alford.
Thank you. I would like to ask a question about the digital front door referred to in paragraph 4.5. And I'm interested really in what's the other side of the door, and how do families get to know what is the other side of the door and feel encouraged to open it?
Thank you. Really helpful question, because it can be quite hard to describe a virtual world. Three things really. So firstly, it is about having really good information that is available to people at the touch of the fingers that meets their needs. So the first thing that we are looking to remodel and improve is the local offer for children and families with special educational needs and disabilities, because we know that that's one of the first places that people look, and we want to make sure that it's really trusted and good advice on there, and we've got a bit of work to do. The second bit is around having potentially things like web chat or someone at the end of the phone who can answer some of those questions. So just as Councillor Jones was describing needing something in the evening, if you've got a challenge with your baby and you're worried about them not sleeping, being able to speak to somebody at the end of that's been really helpful, or to have a web chat. And building on what we know that already works. So for example, our health visitors already have a chat text messaging service for that, but trying to join that up together so that there's one place of support for our people to do. And then the third might be about people coming to see you after you've come out and you've had that conversation, or you've spoken to somebody. That might require you to have a bit of somebody coming out to the house and trying to connect you into services. And that might be a parenting course, or it might be some advice and information. And some of those parenting courses we might do online, where it makes sense. So it might be that we would do our Incredible Years course online because there's nothing happening in your local area that week, but we want you to be able to come on board. So it'll be a mixture of different things. Lots of work to do around communication and making sure that we get that message out to the right people. The piece of work that we're doing with the council's system is that that information is pushed to people automatically, so you can register onto the council system and they'll know that you have a child age 3, 4 coming up for school transfer, and automatically get some of that information out to you about school admissions, helping you understand some of those deadlines. So that's the work that we're doing alongside this to develop our digital offer. And that's another piece of the transformation programme within Children's Services that sits alongside this, and the two go hand in hand. We can't do one without the other.
Thank you. Councillor Alford, did you want to come back?
No, just to say that was a helpful answer. Thank you.
Thank you. Councillor Knox.
Thank you, Chairman. Two things, and they're challenges. I absolutely welcome this because, of course, this is prevention at scale, which is absolutely at the heart of what we should be doing, so that we save not only lives, but chaotic situations for families in the future, and we try and ensure that we prevent that situation for them. I would like to see more finance put towards this in order for the implementation for 2025 to be brought forward. I know, Andrew, and you're probably pushing as far as possible as you could, but I would really urge that the Cabinet and the Council see this as a really high priority, because as soon as it is implemented across the geographical area, and really rural areas. The payback to others, not only in terms of families, but actually the financial pressures of other partners who you've mentioned, Claire. I very much appreciate that it is for the NHS and the police to also ensure that they fund. So I push on that one. The pushback will be enormous, and the payback will be, sorry. And I'd really like, if we can, there are means of measuring the social impact in financial terms. And a report such as this on how family hubs are actually delivering should include the social impact on other partners and on people in terms of finance. It's not all about money, but that really helps gather momentum and support from others if you can show what that is, not only the opportunity cost, but the social impact in monetary terms. So thank you. I don't expect an answer. It's just me posing some questions for consideration.
Thank you, Councillor Knox, and as always, I'm grateful for your support on these matters. You are absolutely rightly to identify the fact that although Children's Services are leading on this, it doesn't just sit with the benefits of Children's Services. It's about strengthening families, and that, of course, is across age ranges, but of course across communities as well. And there will be a full part, I'm sure, for our partners and other services to step up and have their input as well. But absolutely, I don't think we should just look at this in how it benefits Children's Services, but in that bigger piece of the whole community.
And just to add, you're absolutely right around social return on investment, and I think we can do a lot bit more work as we're developing to do that. And I know that in some other areas they've already done that, and we have some of the tools based on our harbour model, and we're really tracking social return on investment for that with our police colleagues, and it's making a difference actually to the conversation about investing together and what that looks like. So yeah, challenge accepted. I'll make sure that we pick that up and move it forward.
Thank you for that. I believe all committee members that wish to speak have now spoken, and therefore I open it to non-committee members. Councillor Carol Jones.
Thank you very much, Chair. I couldn't miss an opportunity to talk about family hubs. I'm sorry, I'm here. We're undergoing at the moment a review on libraries, and we are looking to make libraries, in some cases, far more relevant. And I would actually be so bold as to suggest, could we make it a recommendation that those libraries that can take a family hub are identified and confirmed so that we can then look to see where the gaps are? I think this would be an important step forward for family hubs and for the libraries. I also want to suggest that when I look at the families I'm working with in the Vale Pantry, which is well over, well, we're approaching 250 at the moment. There are families that we are aware of that probably social services don't know about. And I know that there is a huge case for much more work, whether it's helping them identify a child who's not developing properly. And some of these mums, they don't know where to go. They'll go to their doctors. They won't go anywhere else other than the doctors. And very often they're just left high and dry and frustrated that they're really concerned their child is not developing properly. There are parents that really have no idea on how to cook a nutritious meal. So some of these things that we can look at are quite basic, but they're so fundamental. And certainly I think there's a huge opportunity to work alongside, for example, the Vale Pantry. We are a registered charity. We can apply for funding to help get this, because I'm putting my flag down now. I want one in Sturminster. And I know Home Start want to work with us in Sturminster. We have families. So, you know, we can apply for funding and actually work alongside. And it's just really important that we're brought to the table to get this off the ground, to be honest. I mean, one thing I know certainly, very often we might have people that are in Stallbridge, Shaftesbury, Gillingham, Oakford, Fitzpaine, High Ransty, all over. And sometimes if they can't get the only family car, if they've got one, they can't get into us for food. So if we don't make it easy for these families to get to us, they could fall by the wayside. And it's just really important that we have some sort of safety net. So I really would like us to see whether it's possible that we can come back and just say, these libraries can take a family hub. Where are the gaps? Can we make that? Could I be so bold as suggest that we ask that to actually be taken forward as a recommendation so that we can then look at where the gaps are and how charities like ourselves can help fill the gaps? Thank you.
Chair, if I may come back on a couple of those points before I hand across to Claire Shields. I am well aware, thank you, that there is a piece of work going on regarding how libraries are best utilised for our communities going forward, and we have outlined, of course, today, part of that may include the family hubs. I have had the opportunity to visit the library in Sturminster Newton and see the work that undertakes there in the community, as well as the Vale Pantry, and I once again congratulate you on the amazing work that you have done there. I think you reflect back on something that was said earlier on the meeting, which is the use of councillors in their wards and their knowledge of how to support families. I do hope all councillors will want to give those families who confide in them the confidence to engage with our officers and other allied partners in helping to support them and to overcome some of the difficulties that they have faced, in some cases for far too long.
Thanks. And just wanted to give you a little bit of reassurance that we are having a conversation with the library's team around which of those buildings may be suitable and or might be useful outreach spaces, if not a whole family hub. And we have had a local peer review from the LGA about how libraries can contribute to the family hub strategy. So have some recommendations on that. So I'm working quite closely with Lisa Cotton on what the future strategy might be about the right places and spaces to deliver some of our work, including family hubs and within the libraries. So it's an active piece of work and we're joining those two things up together.
Thank you. Could I ask where that information will come back to?
The library review information is held with Councillor Laura Miller. She's leading that under the communities piece, so I would have thought it would be Laura who would be bringing it to this committee.
Thank you. And I think just to clarify on that point, Councillor Jones, you're aware that we are due to have a joint overview committee that you and I chair. And that has been postponed for further work, and I think we'll ensure that that is included when that report eventually comes to the Joint Overview Committee. I think that message is well and truly understood. Councillor Stella Jones, do you wish to come?
Yeah, only to say I think it's a good idea to use libraries for all sorts of new ideas, such as families. But I think a family hub is different to a library. A library is a very public place, and as a family, if you've got a problem, you wouldn't want to go to the local small library where everybody would know you've gone with a problem. You need to go to somewhere a little bit more private, which I hopefully family hubs will encourage people to go, because they're not, they're obviously public places, but they're not open to other people to go and sit here or listen or see what they're doing.
Yes, thanks. We need definitely a range of places and spaces. And in some cases, a library will be absolutely fine for absolutely getting some elements of help and support. And some of them have private spaces that people can go off. So it's a really helpful front door for people. In other places, it won't be the right place in the community. So that's why we're doing it locality by locality and having some conversations locally about what will work. And the library will be right sometimes, but it won't be other times.
Thank you. I'd like to sort of wrap that up now. Thank you, Claire, for you and your team's work. I think this report was a far better place than we were at the last meeting, so thank you for that, and thank you for your input, Councillor Parry. I would like to see this come back to this committee at some point for an update. Now, I'll take a view from members whether we bring it back as an agenda item or whether we should have a members' briefing on this. I'd just care for anyone's views. Councillor Parry, I believe you want to speak.
Just in consultation with the director there, we'd be happy to come back and see you in the autumn, suggest October. If that would be acceptable to you.
Yeah, a member's happy with that. I'm seeing nods in the room. So yeah, if we can bring that back, I say some terrific work's gone on, and I think we'd be very keen to see progress. Thank you. We now move on to item 8, which is resettlement and the Homes for the Ukraine scheme, which I believe again is you, Claire. Thank you.
Yeah, thank you. Really helpful to be able to come and provide you with an overview of what is quite a fast-changing piece of work, and things have changed really since I've written this paper as well, so I'll be able to provide some updates. Just in terms of an overview, we have really got a proud history in Dorset of welcoming people to resettle from lots of different countries and multiple different schemes. And the Homes for Ukraine scheme and reaching out to support people fleeing conflict from Ukraine has been no different. So we have had an overwhelming response from the community stepping forward who want to help, which is really helpful and heartwarming, and a real privilege of a piece of work to work on. So thank you to all the people of Dorset who have stepped forward. And thank you to the people of Dorset for their continued patience as the 2 visa schemes have been developing over time. So there are 2 main routes of entry for families fleeing Ukraine. The first is the family visa scheme, which is operated by the Home Office, and the second is the Homes for Ukraine scheme. The family visa scheme has no statutory role for the council in being involved. It's really through the Home Office and people independently organising themselves. However, when families arrive, they're entitled to all services that anyone else would have, so they may come into contact with our services. The second scheme, the Homes for Ukraine scheme, which I've gone into in more detail in the paper, is one where the council has been given some responsibilities to be able to help and support the implementation, and those are detailed in the report. The Homes for Ukraine scheme intended really to help families that people that knew people in Ukraine to come over and be part of the UK and settle here for short periods of time. But actually the number of people that have stepped forward and expressed an interest in doing that has been more than the people that we've been able to match. So the matching of families in Ukraine to people that are willing to sponsor them here has been a bit of a challenge, and I've laid that out in the paper. The matching happens completely independently of the council, so the Home Office does the matching. We're really keen to make sure that we get the message out to use trusted charities for that type of matching rather than going through social media, as we know there are more risks of exploitation for people fleeing conflicts. We just want to make sure that we get that right. So really important that we use those national schemes and those national charities and international charities to do that, as frustrating as that may be, because it's a little bit slower than reaching out through social media, but we know that it is safer. So that's really important. I think in terms of the work that we've been doing, the council has managed to stand up a really strong team across the whole council, so it's all council services, to be able to support this scheme, and working really hard with the community and voluntary sector as well. So the Dorset Together network, which was so effective during the COVID period, has stood up again to be able to support this programme of work. Things that we are responsible for include the accommodation checks, and we have our housing team going out and checking housing, making sure that it's appropriate, and making sure that there's enough room and space to support host families. That's working well. The team are out and we're getting really good feedback on that. Undertaking DBS checks for potential host families. Again, that's working really well. Volunteers Centre Dorset are doing it on our behalf, and those are being turned around in 48 hours. So they're being prioritised nationally, so we have no delays there. The council's responsible for administering a £350 thank you payment for hosts, and we have the system set up to be able to do that now in place. And we're also responsible for providing some initial support for people as they arrive in the way of some financial assistance, and that looks like a £200 card for people. That has been more of a challenge. There's been some delays in getting that out to families as that we've arrived. We now have a good system in place and have worked through some of that. But really important, if you're aware of anyone struggling with that, to make contact with us so that we can prioritise getting that out to people. And in terms of where we are, as of today, we have over 100 Ukrainian people have arrived to the UK. We have over 200 sponsor families that have been matched, and we're anticipating through the Homes for Ukraine scheme over 500 people arriving in the next few weeks. So we're just working through that. The next steps for us is welfare checks, just to check in with families and those who have arrived to make sure that they're okay. And we're in the process of doing that and making sure that we can get the payment out to people as we come. But a really strong community response from Dorset people and a really good One Council response moving us forward. We are still awaiting some guidance from government. Since I wrote this paper, we have now received the financial guidance that's coming through to councils about how we will receive the money, what that looks like and how we can get that out to people. We've received that. The one thing we're still awaiting, which would be really helpful, is about how we could potentially rematch hosts and families and guests. If when they arrive it just doesn't work out for whatever reason. We're hoping to get that quite soon. We have received information about those people who have expressed an interest but haven't yet been matched, so we know we can start some work on that. And we're pushing quite hard through our Southwest and national networks for that guidance to come out as quickly as possible. Thank you.
Thank you, Claire. And I think, first of all, thank you again for you and your team to responding to this, but more importantly, to put it on public record, Dorset Council's thanks and gratitude for their response. And I'm sure we've all seen it in our own communities and wards, but the tremendous response, and listening to some of those figures that you've just shared with us, Claire, the way that Dorset, and we're very proud of Dorset, the way they've stepped up to the mark in this terrible, terrible situation the people of Ukraine find themselves. So I think we need to put that on public record. Thank you. Any members wish to speak on this? Councillor Knox.
Thank you, Chairman. I just want to try and ensure that Claire isn't overwhelmed. Claire's the only name that I have as a ward member to contact about people who have accommodation and people who have issues. So outside of this meeting, Claire, I'm sure there are others that we should be using because your inbox must be overflowing. It is part of the generosity of the residents of Dorset, but also because you are a very trusted person who I know has and does get back to them. But please share with the other 81 members some additional information. That would be really helpful. But thank you. It has been an incredible response and a brilliant paper. But as you said, much has moved on. Thank you.
Thanks, and I'm happy to provide an update, really. And it is a whole council response, so you may have my name, but there are a huge team of people working on this, including Lisa Cotton from the Library Service and Andrew Billany from our Adult and Housing Directorate as well. We're leading this together, so and lots of people working on this. First port of call is Dorset Direct, so they can deal with all operational queries that's coming through. So the Dorset Direct team have been stood up. There's a team of people there working on this. They're the hub, the engine room of making this happen and can respond to all queries. But we're happy to take queries as well and make sure we get them to the right place.
Thank you. Councillor Ezard.
Yes, thank you, Chair, and thank you, Claire. Yes, it's actually working quite well in Purbeck. I've reset up my Helping Kindness little group, and we had a meeting, and someone that was hosting wanted to find out who else was around that they could share, the experiences. So we had a meeting last week in one of the cafes, and actually it worked out really well because people were a bit confused about the two different ways of doing it. The UK family scheme and the the Homes for Ukraine scheme. So I was able to point them in the right direction, signpost them to all sorts of things. And as we were just saying, the Dorset Direct team, go on, even Dorset for You, that will point you in that direction, and the Helping Kindness, and John has been really, really helpful, and some of the councillors around have been more than helpful with all their experiences as well. So I was able to point the people in that right direction. There is some frustration about visas. There is some frustration about who to contact and what. I had somebody yesterday saying, I've been told to contact my MP, and she said, is that the right thing to do? And I said, well, I would go to Dorset Council first. I would go to www.helpingkindness, and talk to John and send an email to John. And I said, I think you'll find all your answers that you need there. And I think, pointing out the differences, if you've got a family scheme where you've got a contact through your family or some relation, that is slightly different from the one that we're offering. And so people were very, very, really wondering about why is there so much delay. But I said, I think it's universal at the moment. But I said, the local governments are dealing with it, and Dorset really got a handle on it, so do get in touch. And I think it's worked really well. So it's not a question, it's a statement to say in Purbeck it is working. And certainly, that the local people usually come to me or go straight on to Dorset for You or Helping Kindness, and that seems to work. And if they're not happy, then they come back and ask for some more explanation from me. But I think there is a lot of myths out there. One question I would like to ask, somebody said, well, I've got a house I usually let out in the summer. I'd like to do that for the families. Do I have to set up a tenancy agreement? And I said off the top of my head, I thought the briefing that we had a month or so ago, that if you usually do a tenancy agreement, you don't have to do that with the families. Can you just answer that one? Thank you.
Yeah, thank you, and thank you for drawing attention to the work that Helping Kindness are doing just to be able to collect people's queries. So I would recommend going on to the Helping Kindness website, and most of the support groups locally are registering with Helping Kindness and pulling that together. In terms of tenancy agreements, there are two different ways of supporting families that arrive. One is through offering a guest bedroom or a spare room in your house, and that's what we're working through in terms of the Homes for Ukraine scheme. And while they don't need a tenancy agreement, it is helpful sometimes to have a bit of a written agreement about what that looks like and where that's going to go. In terms of you're offering your whole premises, but not through the Homes for Ukraine scheme, you might want to have a different conversation around tenancy agreements. We'd be really happy to talk through with the people you've been talking to about what's the best route for them. If it's a self-contained unit, not within the family home, it might be more helpful to think through in a different way. And we are capturing some of those offers of help through the resettlement team, because while they may be appropriate for the Homes for Ukraine scheme or people coming from Ukraine, they may also be appropriate for some of our families that we welcome through our other resettlement schemes in the longer term. So we're happy to have a bit more of a nuanced conversation at an individual level, if that helps.
With the situation with somebody, letting their house instead of letting it for a summer let or whatever, a 6-month agreement, would the council give them a steer on actually how the end of the term would be and all that sort of thing? Like you say, there'd be a loose arrangement without being too onerous. That's it.
Yeah, we can offer some help and advice. There's also some draft light touch tenancy agreements on the government website that people can adapt and use as well. So yeah, happy to have a conversation, come through to Dorset Direct just to talk that through, and someone from the team will be able to have that conversation.
Thank you. Councillor Jones.
It's very good that we're welcoming all these families into Dorset. Can I ask about the children? Now, obviously, they're coming and they'll want to join in schools. And you say a lot of them haven't arrived yet, so they're probably going to arrive at the end of May, beginning of June, which is, to the older children, the schools are busy with their exams. It's a difficult time to join a school. And then we've got the school holidays. Are we planning activities to keep these youngsters occupied during the whole, right until September, when schools, and they can actually settle properly in the school routine then? So say at the moment, if you join a school for the older children about June time, it's just not very good, it's a bit chaotic. And can I just, one more question, can I ask, because there are different ways of people entering from Ukraine, are we likely to miss out any families? Are we ensure that we find all the children and families?
Yeah, thank you, Councillor Jones. So we know that we have 58 children either arrived or on their way, and we're managing all school admissions through our school admissions team. So we're tracking that really closely and working closely with schools around what a warm welcome might look like, but also thinking through access to childcare as well, and what that might look like. So we're mapping those locations of those children and having a think through where are they going to be. And schools have been universally supportive in wanting to welcome children through. So absolutely, yes, when they join, and depending on what year the group they're in, might look really different for them. We've got the Dorset Together group is working particularly on what the children's offer will be at the moment, and we're coming together next week to work through what have we got, where are some of the gaps, and what that looks like. So we have a bit more of an idea. Some of the things that we're thinking about are the Summer in Dorset programme and ensuring that we have priority access for families that have arrived and what that looks like. Some of them will be entitled to free school meals because they'll access universal credit. We're just thinking through what might that look like and how can we get that done as quickly as possible for people. And some of them will be in work and will need access to childcare. So a bit of work that we're actively doing at the moment, but yes, really important for us to be able to get that right. And in speaking to other people that have resettled in Dorset, so through the Afghan resettlement scheme and the Syrian resettlement scheme, summer activities being one of the most important things that they identified, just to be able to make friends and feel a sense of belonging. So we're just thinking that through at the moment. In knowing who has arrived, we don't formally get notified if they come through a different scheme. However, we are aware that the first thing people do is register with a GP or reach out for a school place. So we think we'll pick them up that way. But yeah, absolutely. We don't formally get notified, but we will be reaching into the community to see how we can offer some help.
Thank you. Councillor Knox.
Thank you. One last question. I note in what we're doing with schools and the amount that each school will get per pupil, but what is the amount for a special needs child placement, please?
It's the same amount.
It's the same amount.
It's the same amount, so that one figure that comes through for early years plus schools, it's the same amount no matter the needs of the child.
Is there a means of challenging that with government?
We are feeding back on the costs of, the real cost of providing some of the support to our national and regional teams. So they will capture our feedback on what that looks like.
Thank you. Councillor Alford.
Thank you. Just a little question, which is that when there is a family member who is over school age and they have a desire to improve their knowledge of English, how does that get done?
Yeah, we're working really closely with adult learning for English as a second language, and we have an offer up and running for that. So Weymouth College have already published their offer, and we're publishing the offers for elsewhere. The adult learning team have already updated their website with some Ukrainian and Russian resources on there for people to be able to access that. And it's a piece of work that will keep communicating with those groups locally that are supporting other people as well. But yeah, ESOL courses, they're called, in place, and we're starting to roll them out.
Can I just have a follow-up to that? That's very helpful, thank you. But I next think about transport. If there are places of learning, how do people get there?
I think transport has been one of the big conversations pieces of the last week, particularly as people have arrived in some of our more rural locations. We're just thinking through how we can provide some of that support. Some of it will be online, so that makes sense. And for others, it's thinking through how guests are supported by the hosts and transport, but also some of the local community groups are thinking through travel and transport as well, and how they can come together to offer a bit of transport. But yeah, I think it'll be one we'll be talking about for a few months actually to just get that right, depending on where people have arrived, if they're in small villages and other places as well.
Thank you. I believe that's all committee members that have that wish to speak have spoken. Non-committee members, Councillor Carol Jones.
Thank you. I've been, I'm called the mother hen in Sturminster because I'm coordinated and I've matched a number of families that are either here or on their way through. The problems that the hosts are having is navigating the universal credit forms because they're just simply not made for a Ukrainian refugee. And I wondered whether we could have some sort of step-by-step guide to say when it wants UK passport or when it wants your P60 or whatever, what could they put? Because they're really finding that difficult. And then when they try and phone the Citizens Advice Bureau, it's a nightmare. You cannot get through. It's absolutely impossible to get through to Citizens Advice. So then we try the Job Centre. Well, the Job Centre's an 0800 number, and you are really lucky to get through to the Job Centre. Neither can you go to a local job centre. Apparently, you've got to go to Poole. But these things we're coming across almost by chance, to be absolutely honest. And also biometric residence permits. Apparently, they're 6 months, but it seems to be confusing as to whether you can do this online or whether you actually have to go to either Bath or Southampton. And I just think it needs to be a bit clearer. And when I've called Help and Kindness, to be honest, they don't know either. The big gap that we've got that I can see is a lack of dentists providing NHS care. In Sturminster, the dental practice there that was offering NHS treatments have stopped, and they've said to all their patients, we're no longer doing it. We've got a right problem there because we've got mothers with children that can't afford to get their checkups done now. So I don't know how these people are going to access dental care in an affordable way. I don't think they can, quite frankly. I've been in touch with Sam Crowe. He says he's got no authority and wonders whether we can try and do anything with the CCG. So I'm just wondering what steps can we take in that respect? And the host families, none of them have had to give their bank details for the £350. And they're all asking, we're okay, but when will it get it? And how do they know where to pay it? So I wonder whether we could get something in place to actually say, let's have your bank details, we're paying in arrears, and so on. And just funny, and just a real quickie, the £200 that they get, I think that's on a preloaded card, is that per guest or per family? And is that then per guest over the age of 18? Thank you.
Thanks. I'll take a few of those practical questions and then hand over to Councillor Parry around dental treatment, if that's okay. So firstly, absolutely, universal credit is a challenge and one of the biggest challenges for people. Marie Boyce from the Department of Work and Pensions has joined our Dorset Together group, and we've asked her to do a piece of work around simplifying and myth busting for us. So we're actively working on that at the moment. So we'll get some information out as soon as we can. In terms of the £200 payments, they are per individual, and as per individual, no matter what age they are. We have had a little bit of a delay in getting them out to some people. We had a bit of a bumpy start to the system, so we're just working through a bit of a backlog on those and making sure that we get them out to everybody. Really important, I think, that we get them out as quickly as possible. So yeah, I think we will get there, but a bit of a challenge, and universal credit being a bit of an issue for us. Biometric passports and that information, I will get a formal response from the Home Office. We had a response, but it didn't make sense on the ground, so we're following back up in terms of getting further information on that. In terms of dental treatment, practically, people have theoretically the same access to medical services as everybody else, but we can see that there's a bit of a challenge for that. And I know Councillor Parry wanted to come in.
Thank you. Just very briefly, and I'm sure we would enjoy the support of Councillor Rebecca Knox in this matter. We would see this progressing politically through the Health and Wellbeing Board as the right forum for that discussion to take place, and I'm sure Councillor Knox and others who sit there would wish to do so.
Thank you, Chairman. We actually were in touch over the weekend, weren't we? And I did actually point Councillor Jones to Sam because dentistry is about prevention. So there is a public health policy and driver behind it. But you're right, it is the CCG. But I will absolutely now take that up with Forbes Watson and see what the answer will be. It was a headline issue in one of the Sunday papers, no, yesterday's papers about dentistry, the lack of provision from the NHS across the whole country, but it's a really important matter. And together with health and people scrutiny, but led by the Health and Wellbeing Board, thank you for making that part of what can be our forward planning for the board. But it obviously needs immediate attention. I'm afraid I'm not sure there's going to be an immediate answer, but if we can get something in train and use, sadly, this point in order to be another driver to the to dentistry services, that would be really helpful. It's sad that we have to do it in that way, but thank you very much for involving the Health and Wellbeing Board.
Thank you for that. I welcome that. So could you let the hosts know about when you can get their bank details, please, because just so that they know they're covered on that respect.
Yeah, absolutely. Further contact being made operationally this week. Two things need to happen. People need to say that they wanted it originally, so we'll have to go back and check through that they have said yes. So if they haven't said yes, please contact Dorset Direct, and we will be in contact to make those payments. They are payment in arrears. And payment usually following a welfare check, just to check and guests and others have arrived. So we're in the process of organising all of those welfare checks as well. It will come. Commitments there.
Thank you. Councillor Borden.
Thank you. Belinda Borden, Lyme Regis and Charmouth. We've got a couple of informal support groups going in Lyme Regis, but sort of looking across East Devon, because I was part of, what do we call it, Uplyme Community Sponsorship Scheme, which we did set up formally as a charity, and those to bring a Syrian refugee family over. And the feeling amongst that group was that they didn't want to go through the formal charity route. So, but several of us with experience have set up an informal network with across East Devon as well, with expertise. And we had a public meeting. I think we had about 48 people came to sort of express an interest in being host families. The response has been amazing. And we've been working with Bridport as well. And they, so we've got a sort of once a fortnight informal drop-in session for anyone interested, or anyone interested in just supporting, not necessarily hosting, but supporting and, you know, offering help with English teaching or all of those things. And we've actually got a Ukrainian young lady from Ukraine who was kind of stranded in London when the war broke out, and she's decided that rather than go back, she can be more helpful here. So she's actually doing some matching for us. But I did also want to say that some of the families at our last group meeting said to congratulate Dorset Council on the home checks and all the information and advice. They said it's been absolutely first class, and they wanted me to pass that on to say thank you. And yeah, sorry, just to say the Bridport Quakers are doing sort of the week that Lyme Regis isn't doing an informal support session, the Bridport Quakers are holding an open meeting as well. So we're all getting organised and passing on the information. Thank you.
Thank you. And that's happening and being replicated across many different communities, and really helpful informal networking and support that makes a difference. And I will pass your thanks off over to the team. They've been working really hard, and having some positive feedback really helps keep it going, because people are doing this on top of already busy day jobs. So thank you.
Thank you everyone for your input on that, and I think it goes without saying, I know we had a number of questions on that, but you've got the wholehearted support of the committee for the work that you are doing, and I'm sure we'll continue to do so. So thank you, and thank you again to your team. Okay, we'll move on to agenda item 9, which is the committee and cabinet forward plans. They have been tabled in the minutes. I don't intend to go through them verbatim unless anyone wishes me to. Just a reminder that next Wednesday we have the additional People and Health Overview Committee, specifically with the one agenda item of Care Dorset. Look forward to seeing you there. And we've also agreed in this meeting that at our meeting of the 27th of October that we'll have an update on the family hubs. The rest of that forward plan does need fleshing out, and I'm very conscious of that, and we'll be meeting with Cabinet colleagues over the next few weeks to flesh that out as we move forward. Does anyone have any comments on the plan of the committee? Councillor Alford.
Yes, just one general remark, which is that I understand that some of the financial parameters around charging for adult care services are going to be changing, I believe in October 2023. So I wonder if this is a topic for discussion at this committee at some stage. Alternatively, whether before then it has any impact on decisions that are likely to be addressed to the Cabinet.
Thank you very much for the question. I'm Vivian Broadhurst. I'm the Exec Director for Adults and Housing. Absolutely, there's social care reforms coming in October next year, and we'd be very happy to bring that, the outline of that, to the committee for further discussion if the Chair is supportive of that.
Thank you for that. When do you think you'd be in a position to bring that to this committee?
We would be happy to bring that in June, if that would be helpful.
Thank you. Are you happy with that, Councillor Alford?
Yes, I'm fine, thank you.
Thank you. Councillor Knox.
Thank you very much, Chairman. I note at the bottom of the forward plan there is an item that says potential agenda item, leisure strategy. I'm not sure that that can be discussed today, but if officers might actually take away the suggestion that this is looked at in terms of what Active Dorset are doing for us as a council underneath the policy development of the Health and Wellbeing Board, to possibly bring those together, because they shouldn't be working separately. And I think that that would be very helpful, and indeed there's quite a lot that Active Dorset, as our development of doing more, moving more policy, would be able to bring to this committee, not necessarily in June, because that's looking quite busy, but that's up to you, Chairman. But I think that would be really helpful, and do it in tandem. Policy shouldn't be being worked on in silos. Thank you.
Absolutely, policy shouldn't be worked on silos, and I encourage all children and young people to have active lives and participate in sport and leisure when every opportunity. So much to be gained from it. But this particular part of policy would be led by Councillor Laura Miller, I believe. So I'll take the liberty, if I may, of suggesting that, yes, we will bring this to this committee, but I will need to engage with Councillor Miller to ensure that happens.
Thank you, Councillor Parry. Just to put some timescales on here, I think it would be inappropriate to bring it to our June meeting, as that looks a fairly full agenda. However, I think if you can indulge Councillor Miller with the 8th of September as a realistic target, that would be appreciated. Thank you, Councillor Parry. Councillor Ezard.
Yes, thank you, Chair. On similar lines about the leisure strategy, I and several other members here were on a sort of task and finish group a couple of years ago, and I'm not sure what actually happened with that, or it was sort of suspended, or we didn't seem to come to conclusion on it. I know a lot of things have changed since then, so is this leisure strategy something to do with what was discussed then, and is that is that task and finish group or EPC or whatever it is going to be, started up again? I'd like to know. Thank you.
Thank you. I think it's fair to say I was also on that, and I believe Councillor Alford led on that. So there's a few of us in the room that were involved in that. I do believe, unless Andrew's going to correct me otherwise, this now sits with Laura Miller as a portfolio holder, and we will ensure that that what comes forward to that 8th of September meeting includes some of that work that was done by that previous EAP that we all sat on. Thank you. Did anyone else wish to speak on this? Okay. The only other one on this agenda item was the Cabinet forward plan. Again, happy to take comments, or we can just note it. I'll take it by the stunned silence. That's noted. We move on to item 10. There are no urgent items. And item 11, exempt business. There is no exempt business. So at exactly 11:30, I close this meeting, and thank you for your contribution, members. Thank you.